Sai Ram, my humble pranams at the lotus feet of our beloved Bhagavan. Dear Sai brothers and sisters, we are currently going through difficult times with COVID pandemic. We need to face the reality and be responsible. We are now hearing the emphasis on the slogan, stay home, protect the NHS, and save lives. But we need guidance and advice as to how we can look after our dental health to avoid outside exposure. Most dental practices are open now, but the cases are prioritized for treatment. With Swami's grace, we have two eminent dentists, a couple who have lovingly accepted our invitation to enlighten us with the dental issues we might face and to advise us as how we can protect our dental health. Dr. Keval Shah, qualified from King's College London and has over 10 years of experience within dentistry. He has trained within the fields of cosmetic dentistry, oral and maxillofacial surgery, and special care dentistry. He has been a part of the International Rota of Dentists at the Sri Sathya General Hospital, Prashanthi Nilayam, and attended several medical camps around the world serving people in need. Dr. Bijal Sisodia-Shah is a qualified physiologist and an award-winning dental surgeon recognized for her passion in helping the most nervous of patients. She too has been blessed to be able to serve for numerous years at the Sri Sathya General Hospital. She has held multiple center and regional roles in the Sri Sathya International Organization and feels blessed to have been involved in numerous international medical camps and has helped to initiate UK health awareness projects. Together, as husband and wife, their favorite quote from our beloved Bhagavan, Sri Sathya Sai Baba, is to love all and serve all, and they make this the purpose of their lives. Sai Ram. Now, over to Dr. Keval Shah and Dr. Bijal Sisodia-Shah. Thank you.
Jai Sai Ram. Today we will be talking to you about dental health and why it is important. The key topics that we will be covering are the importance of oral health, providing you with an understanding of teeth and the oral cavity, underpinning why regular visits to the dentist and hygienist are so important, and finally giving you good oral hygiene practices and top tips to look after your mouth. The mouth, in essence, is actually a mirror and a gateway to the rest of the body. And this means that any diseases or conditions of the body can produce signs and symptoms in the mouth. This could be noticed by your dentist, or it could be something that you notice. You could go to the dentist to have it checked out. Your mouth could be a source of infection, and that is why good oral hygiene and diet is incredibly important, especially during the challenging times that we're going through right now. And that is why regular visits to the dentist are so essential. So just like some of the other organs in our body, the tooth is actually an organ. Just think about all the other organs, for example, the brain, the heart, the stomach, the kidneys, etc. They all have specialized cells in them. They have a blood supply, they have a nerve supply, and all of this works beautifully together as a functioning unit, which we call an organ. In a similar way, a tooth has a central blood supply, it has a nerve supply, and something called a pulp chamber, and this is covered by living tissue, which is dentine, which is thin nervous strands going through it. And on top of that is the enamel layer, which is the white hard layer, allowing us to chew and break down our food. So what are some of the common causes of pain in our mouth? It could be toothache, or it could be dental abscess, which is another name for an infection. It could be gum disease, which is also called periodontitis, or it could be a broken tooth. It could also be dry mouth, which could lead to soreness. Or it could be painful ulcers, which may last from a few days to a few weeks. Or it could be pain from an impacted wisdom tooth. Finally, it could also be pain from the TMJ, which is the temporomandibular joint. And this joint, just like all the other joints in our body, has a disc inside. It has tendons, ligaments, and muscles connected to it. So it's sometimes bound to undergo some sort of injury or trauma or overuse, which could lead to pain and discomfort. Thankfully, most of the above conditions that we mentioned are preventable. So let's take an example here. Let's say Mr. Stress, a patient, walks through the door. He's 56 years old, he's married, he's the father of 2 children. He's an accountant by profession. Medically, he suffers from hypertension, which is high blood pressure, and he has diabetes type 2. He's also a long-term smoker. So what does he have to say? He says, over the last few months, I'm getting headaches, especially when I wake up in the morning. He says, I know I should have come earlier because I've chipped my back tooth. It wasn't really hurting until now. And I think it may have developed into a big hole after I lost the filling. Oh, and I've also noticed my tongue is sore for the last week. I've just been so stressed with work and I've been worried about coming. It's been some time since I saw the dentist last. And generally, I'm quite nervous about coming.
So, what do we find during Mr. Stress's consultation? And what is it that we do when we see a patient having a dental checkup? There is so much that we do. Before we even have a look inside of the mouth, we will often look outside, and that is to assess the jaw joints, the muscles associated, your lymph nodes. All of this can tell us so much. And then we have a look inside of the mouth and do a soft tissue examination. This means that we look inside of the cheeks, your lips, your soft palate, your hard palate, your tongue. And, like we said, the mouth is a mirror to the rest of the body. So what do we find during Mr. Stress's consultation? I noticed that there was some wear on his teeth, and this can also be known as attrition. I've noticed that his gums are quite swollen, a little bit of bleeding. He's got multiple ulcers on the sides of his tongue. His teeth are a little bit sensitive as well. And don't forget, he did say that he had a tooth that he'd lost a filling from. And we noticed when we did some x-rays and we took some photos, well, this was very close to the blood and nerve supply, hence it was giving him toothache. And do you remember Mr. Stress said that when he'd wake up in the morning, he would have headaches? So when we assessed the muscles associated with the jaw joint, we noticed that his temples were very tender. So just by his dental checkup so far, I can already tell you so much about Mr. Stress. So let's have a look at the dental decay. So we noticed that he had decay on a few of his teeth. Now, what is dental decay? Basically, dental decay occurs from consuming too much sugar. We all have natural bacteria in the mouth, and the bacteria love sugar just the way we may enjoy having sugar, and it feeds off this, producing acid, and that actually creates cavities. That wears into the first layer, which is enamel, then dentine, and then into that blood and nerve supply, which I call basically the heart of that tooth. It pumps, it's got nerve fibers. And of course, if any bacteria make its way through this can cause pain. So what causes decay to your teeth? It's a combination of factors, from poor oral hygiene, not brushing effectively, not getting into where the gum margins are, maybe having a lack of fluoride into the toothpaste, and the diet plays such a big role. What we know is that our mouths can take up to maybe 4 hits of sugar, and that includes your breakfast, your lunch, your dinner, and a snack. Because when we are talking about sugars, there are different types of sugars. There are foods that also break down into sugars, such as bread, rice, pastas, and of course, frequent grazing on food. We mean that there's an increase of these sugar attacks, hence why there's more production of this acid more frequently, and this will cause cavitations into the layers of the enamel and the dentine. And of course, if it goes and makes its way in through to that blood and nerve supply, this is eventually going to give you that toothache, and that can often lead to infection as that nerve and blood supply starts to die off. This is obviously one of the common things I see as a dentist. But the good news is this is all preventable, and we'll be going through that throughout the presentation. Now, we said that Mr. Stress also had some bleeding and swollen gums, and this can often be a sign of gum disease. So what is gum disease? It's actually a way your body telling you that there is something wrong. So often food and plaque can get in between where your tooth and gum are meeting, and this should be really snug and tight. But of course, if there is pocketing, so if you're getting food and plaque getting stuck in those areas, this can lead to inflammation because the blood cells are rushing there into that area, and that can cause this inflammatory response because the body is trying to get rid of the plaque and the food getting stuck there. But if we're removing that, this response doesn't need to occur. So what this can also lead to is a loss of the support of the bone surrounding the teeth, and this can then lead to teeth becoming quite mobile and eventually losing teeth. So it's so important that the foundations of the teeth are well looked after. It can also lead to other health problems, such as an increased risk of suffering from diabetes and heart disease. There's a very strong correlation between these. So what are the causes of gum disease? Again, poor oral hygiene. That is one of the biggest causes alongside smoking and uncontrolled diabetes. So let's look at some of the other things that we've seen in Mr. Stress's mouth.
So Mr. Stress also complained about having ulcers and pain from them. Now, when it comes to ulceration, there could be different types of ulcers, and there are also many causes to it. So if you think about where it starts from, it could be a local cause. It could be trauma from a sharp tooth or a part of a denture rubbing against the soft tissue in the mouth. Or it could be a systemic cause, which is basically something that's coming from the body itself. So it could be related to anemia, which could be iron deficiency because I'm not getting enough or putting in enough iron. It could be a gut disorder, something like Crohn's, which could present with ulceration in the mouth. Or it could be nutritional deficiencies, whereby if someone's not taking enough vitamin B12, again, ulceration could start. Rarely, blood cancers, for example, lymphoma, may present with ulceration in the mouth. Oral cancer, incredibly important. Again, very high risk for people who smoke and who drink regularly. Something that can present as an ulcer. And this definitely need to be checked and needs to be referred on. But we have to make sure to tell you that anytime you get an ulcer, please don't get alarmed or worried. Go to your dentist, have it checked. And then the dentist himself or herself can actually recommend a blood test or a biopsy and refer you on to the hospital so it can be checked. Now, what about smoking and pan and betel nut chewing, which is quite common amongst Asians? As we already heard, smoking causes gum disease, which could ultimately lead to tooth loss. Oral cancer, as we already mentioned, both of these factors is a very high risk for oral cancer. Both of them can also cause dry mouth, which can lead to not only bad breath, but also tooth decay. Now, obviously, it could also stain your teeth quite badly. So again, that affects you socially. And finally, when there's a lot of chewing of pan and betel nut going on, it could lead to something called submucous fibrosis, which is basically fibrous bands that develop inside the cheeks and limit the mouth opening. So it makes it difficult for you to clean your mouth. It makes it difficult to put food in your mouth. It makes it difficult to even have a dental checkup when pain or discomfort arises. So it's best to avoid this because it's very, very difficult to treat.
So one of the other things that we talked about was how stress can actually impact you in so many ways, mentally, physically. But what does the oral cavity tell us? What do we see when we have a look at Mr. Stress's mouth? So, we noticed there was a little bit of wear occurring on his teeth, but he also had associated pain. Now, all of this actually comes together. This paints us the picture of the degree of stress that he is going through. Because what he is actually doing is clenching and grinding his teeth, subconsciously not even knowing it, during the night and sometimes during the day. This is stress related, and often this can lead to temporomandibular joint disorders. Now, as you can see on this diagram here, there are a multitude of muscles attached to this tiny joint just here. The largest muscle is actually this one here, called the temporalis muscle. So what is actually happening to these muscles? It's like going to the gym every single day for these muscles and never getting any rest. So what is occurring is that these muscles are consistently being used and contracting and never getting a rest day. So there are so many ways that your dentist can help you to manage this parafunctional habit, which is also known as bruxism, which can often lead to this disorder of the jaw joint called the temporomandibular joint disorders. And what we can do to help you is often provide you a night guard, a sleep clenching inhibitor. And for a lot of my patients, I would also use acupuncture to help targeted muscle areas release endorphins to help those muscles relax. So if this is something you're experiencing, please do go see your dentist, because there are so many ways we can help you. And I always say to my patients, stress can exhibit itself in so many ways, and going down to the root cause of stresses and learning to manage those stresses is so important. So doing meditation, yoga, anything that can really help those muscles is so important. So I guess the question is, what does your mouth say about you? Just by having a look, that maybe that half an hour appointment with your dentist you could learn so much about yourself. Maybe you're anemic, maybe there are signs of diabetes. There's just so much. So please do, go and see your dentist and see how, he or she can help you. Now, we've talked a lot about some of the key things that Mr. Stress is going through, which you may be able to relate to. And like we said, there are so many things you can do to prevent this. And one of them is good oral hygiene. This is so important now more than ever. And here is a video just demonstrating the way in which we should be using our toothbrush. This is an electric toothbrush, and I'm just showing you the angle in which it should be utilized. So here we can see that the toothbrush is angled so that it's touching the gum and the tooth, ideally at a 45-degree angle. If you are using electric toothbrush, which is what I normally recommend, then it's going to be doing the hard work for you. So ideally, what you really want to be doing is holding it a few seconds on each surface of the teeth there. And make sure you're getting to all the surfaces, from the biting surfaces to the outer and to the inner surfaces. But of course, the struggle can often be getting in between the teeth, because don't forget, bacteria doesn't just sit on teeth, it sits on everything in the mouth there, from the inner sides of your cheeks to your tongue and in between the teeth. And flossing, therefore, is so important. So here we have a demonstration of the ideal way of flossing. You can see that what we've done here is we've hugged onto the tooth there, gliding straight down into that area, going from one side of the gum to the other side. Just going to show you that again. So as you can see here, we are going from one side to the other side. Okay. So what are our top tips? Now, these are really, really important tips we're going to be giving you today. So first thing is brushing twice a day using this technique, okay? Ideally with an electric toothbrush, and First thing in the morning, that's what you should be doing, brushing your teeth. Once you've brushed your teeth with a fluoridated toothpaste, spit out the excess, but never rinse it off. That's really important because the toothpaste actually is like an armor for your teeth, for the acid attack for the rest of the day. And I always advise to do this before your breakfast. And that is because, like I said, it's an armor for the acid attack about to occur. And using interdental aids. So this can be floss and these can be interdental brushes. Here we can see some examples of interdental brushes. These come in different sizes and you just put those in between the areas of your teeth from the smallest to the largest, depending on the gaps and the sizes of your teeth there. One thing I always say to my patients is, it's so important to obviously be using interdental cleaning aids and toothbrushes, but it's also, we're human beings living on this planet. And so whatever we do and whatever we use has an impact. And now there are so many environmentally sustainable products. So here we can see an example here of, a bamboo interdental brush there. So, do have a look in stores such as like Superdrug and Amazon. They have, different cleaning aids that are quite environmentally friendly. The next thing that is so important is your tongue and making sure that it's clean because, again, it harbors many bacteria and it can often lead to having, bad breath called halitosis. You might be thinking, I'm brushing so well, but I'm still, feeling a bit self-conscious about, this bad breath. And it can be often because we're still harboring bacteria in the tongue. So tongue scrapers are actually excellent to use and I really do advocate for using those. Alternatively, you can use your toothbrush as well. We've talked about diet, during this presentation, but what does it actually mean when we say limiting those sugar frequencies? So the mouth, like I said, can take up to maybe about 4 hits of sugar. That includes your breakfast, your lunch, your dinner, and a snack. And it doesn't just mean, the processed refined sugars like sweets and chocolates. It can often entail other types of foods that can break down into sugars as well. So always limit, your sugar attacks to around 4 hits a day and limit any classic, sugars to your meal times. For children, I often say to them, you have one treat day in the week, like one time in that day. And that is a great way of, limiting those sugars. And of course, look out for hidden sugars. So a lot of foods that you wouldn't normally think have sugars in those sometimes do, from crisps to cordial drinks that say, there's no added sugar, but they have natural sugars in there. So stick to drinking water in between your meal times. If you are going to have, drink that might have a little bit of sugar in there with your meal, then perhaps use, reusable or paper straw so that it bypasses your teeth there. And one of the other top tips is, having a sugar-free chewing gum after eating. Now, this is a great way of increasing saliva in the mouth that actually is has a natural buffering, capacity in the mouth, lowering the pH there. So these are our top tips and they're so important. So I hope that this helps you. And if you have any questions, of course, please do ask. This presentation, I hope, really helps you to see that prevention, number one, is always going to be better than cure. So these are the great tips here that we've given you, a way to prevent decay, way to prevent gum disease. And the other thing is having regular dental checkups with your dentist. I know during the first lockdown, dental practices were unfortunately told to close because we did not know the ins and outs of this, this virus of COVID-19. During that time, now we know that dental practices are really an essential service, and having regular checkups is so important, so important. And I just want to emphasize that, it is safe to go to see your dentist. The infection control procedures have always been so high at the dental practice, and now we're wearing enhanced PPE as well. So it is safe. So don't feel that it isn't. And yes, we are open. So the message here is, look after your oral health, because it is all connected. Everything is connected. The mouth really is a mirror to the rest of the body, and vice versa. So what does Swami have to say about this topic? And, Swami, I'm not going to say anymore. He sums it up so beautifully for us.
తెల్లవారు లేచిన తక్షణమే నోరును మంచి శుభ్రంగా చేసుకోవాలి. పండ్లకు బయట లోపల రెండు విధములుగా కూడాను పరిశుద్ధం గావించుకోవాలి. నాలుకను పైన ఉన్నటువంటి భాగమును కూడాను పరిశుద్ధం గావించుకోవాలి. ఎందుకంటే దేహములకు ముఖ్యమైనటువంటి ద్వారము సింహద్వారము నోరే. ఈ ద్వారం నుంచినే అన్ని రోగములు కూడాను ప్రవేశిస్తూ ఉంటాను. కనుక మనము ఇతరులతో మనం మాట్లాడే సమయంలో కూడాను అతి జాగ్రత్తగా మనం మాట్లాడాలి. మన దుర్వాసన వారికి తగలకుండా, వారి దుర్వాసన మనకు రాకుండా పరిశుద్ధమైనటువంటి దీంతో మన ఆరోగ్యాన్ని కాపాడుతూ పోవాలి.
Thank you, everybody. If you have any questions at all, we will happily answer and help you as much as we can. Jai Sai Ram.
Thank you so much to Dr. Hanson and Dr. Bijal. It's been really helpful. So we have a couple of questions that have been proposed. Just actually on last week, somebody has asked that it's to get a appointment with an NHS dentist. Can we see somebody privately, and roughly how much would that cost?
So it is true. It is difficult finding an NHS practice sometimes. So I think firstly, best to just do call around. Maybe the other number you can call is 111. Find out what's going on through there. But do call practices around and make sure you tell the receptionist that this is my name, this is my address. Give them all your details and make sure they try and put you on the waiting list. So anytime there's a vacancy for any reason, if the limited number of people who are on the NHS list, if someone unfortunately passes away or something happens, there's some sort of availability, then they can give you a call. And obviously sometimes it's urgent, and at that time sometimes we're left with no option but to approach a private practice, which again is easily done. But lots of private practices that you could call and find out if they can see you. When it comes to their charges, it's very, very different for different practices. So it's best to find out when you call them. Normally they do tell you when you call them, and then you can decide where to go.
Yeah, I think the 111 service often will, if you are experiencing pain and you've called around dentists that are close by to your home in your mile radius, and you've not been able to have, get in contact through a dental practice, do ring the 111 service, because they will be able to point you up in the right direction as well. All dental practices will be trying their very, very best to see you, especially if you are in pain. At the moment, because of the need, a lot of patients are in pain, and we are trying our very best to accommodate everybody. So I really hope that helps.
Great, thank you so much. And we've had a few other questions. One being, if you've got little kids, how old do they need to be for them to have their sort of first dental checkup?
So normally the average age of when teeth actually rub through, the baby teeth, is about 6 months old. So that's around the age that they should ideally come with their mom or dad. Even if they can't, if they don't cooperate in letting the dentist see their teeth for any reason, it's something that they can get used to. So every time the parent brings them along, they can get used to the surroundings as they get older. And normally by the age of 2, they're a lot more cooperative most of the time. And then they can, you can check their teeth properly. But it's best to, try and get them in early as soon as their teeth start erupting.
Great, thank you. You did mention about an electric toothbrush being really beneficial. Is there a particular type or brand? And perhaps you could just explain a little bit about how often we should change the heads, if that's helpful.
Yeah. So there are so many electric toothbrushes. When you go to the supermarket and you have a look, you are quite inundated. things that I normally say to look out for. So there's lots of companies that do them, from Oral-B to Colgate to Philips. Key features, what you really want to look out for is a toothbrush head that's got a round, small head. You don't want it to be too large because you really want it to be getting to all the areas into the mouth. You want a toothbrush that's chargeable, like you would charge your phone. Try to stay away from the battery operated electric toothbrushes. One of the great features is pressure sensors. So when you have a look at the types of toothbrushes, at the supermarket, on the box, they'll tell you distinctly the free features. And one of them is a pressure sensor. This is so great because if you are an overzealous brusher, it does indicate either flashes red or stops working when you are brushing and placing too much pressure. Clinical, studies have shown that electric toothbrushes are more effective, and they sort of prevent you brushing and wearing away your teeth down too much because of certain features. But that's not to say you can't use a manual toothbrush effectively. And now there are so many, environmentally sustainable manual toothbrushes like Bamboo. So as long as you're using it in the right way, in that round circular motion like your electric toothbrush towards the gum line, that is really, the very important thing there. So just look out for the key features when you are going. It doesn't need to be the over expensive. I know the ranges from £20 to £200, and you're thinking, is any one better than the other? Just make sure it's one that you can charge, one that has an oscillating feature. And those are the key things. So it doesn't need to be super duper expensive. There's so many different features, but those are the key ones I would probably suggest.
And just to complete the question, the time to change the heads would be, there's two ways. Some brush heads have instructions where the bristles actually change color. So they might be blue and then start going to white. So that could be an indication that the head needs changing. Or the most common presentation is when the bristles start to bend. So when they start to fray out, that's the time to, because what you want is all the bristles standing straight. That's the most effective way that they can actually clean the teeth. If they need time that they start fraying out, that's time to change the head.
Yeah, thank you. And somebody's just asked, is there any kind of advice for bad breath?
One of the most common reasons for bad breath, besides poor oral hygiene, is dehydration. So if you're not drinking enough water, if you're not hydrated enough, you're bound to get bad breath. Obviously, you make sure that you brush twice a day, make sure you floss. This is something that most of us don't do, unfortunately. And a lot of things get stuck in between the teeth, which starts to decay and decompose and give you that smell. Another thing.
Yeah, I was just going to say the tongue. So, it harbors a lot of the foods that we're eating throughout the day. There's a lot of bacteria on there. So using a tongue scraper as well. A lot of patients ask about mouthwashes as well. So mouthwashes are fine. They're okay to use. The key things with mouthwashes is that some of them do have alcohol content, which can be quite abrasive to the inner sides of the cheeks and the soft tissues in general. So I would normally say to avoid a mouthwash that has any alcohol content in there. And don't use your mouthwash straight after brushing, because you don't really want to rinse off the toothpaste. So use the mouthwash completely separate time from brushing, maybe middle of the day when you're coming back in from work, or most of everyone working from home. So just completely separate time from brushing, and that can often help some of those reasons of a bad breath. But if it's something that's persistent, then please do go and see the dentist, because there could be other underlying issues on there. Is there anything else, Keval?
I think it's just the dietary aspect of it as well. If you have a lot of tea, or if you have a lot of coffee, smoking, certain things that have a powerful stench to it. So I think just have a look at everything that you're doing, hydration, dietary, and oral hygiene, and then go from there.
Great, thanks. We'll be smelling like perfume at the end of this. Somebody just asked a question about children's checks. Are they covered by the NHS, or is that something that's done privately?
So yeah, that's covered by the NHS. Yes, up to the age of 18 in most practices, NHS practices.
Great. And another person's just asked, if you have implants or bridges, is it safe to use an electric toothbrush, or would you have to use a manual?
Yeah.
Yeah, electric toothbrushes are absolutely safe. when bridges and implants are put in, they have to be, completely stable. There shouldn't be any sort of weaknesses or movements to it. And if there is any if there's any effect on the bridge or the implant, that means that they haven't been placed properly. So again, the patient needs to go straight to the dentist and tell them that this is moving or there's pain on it. But electric toothbrushes should be absolutely fine.
And lots of people are quite nervous about attending the dentist, and I think there's lots of worries and doubts and bad dreams that people have. And is it that bad? Is it painful? If I had a filling, would it be painful?
So yeah, this is such a common question. I'm really glad this is being asked. First of all, when you do go to the dentist, do let them know that you're nervous. There's a whole team of healthcare professionals there, from the receptionist, from the nurse. The environment is created so it is a relaxing environment for you, number one, just to help alleviate your nerves. When it comes to the treatment itself, there are so many ways that your dentist will try and help so it is not painful. When you're having a filling, the great thing is we use local anesthetic. What this does is numb the actual nerve so that you don't feel any sensations on the tooth there. You shouldn't be able to feel anything sharp, nothing should be painful. And you have that communication with your dentist. So when I'm seeing any patients for any treatment, there's a variety of things I will do to help their nerves, but also we have a little cue to each other. So as soon as they raise their left hand, I always say, raise your left hand if you ever want me to stop, if you need me to do anything, if you just need to take a break, if you can feel anything. There are so many common cues. So all in all, no, it shouldn't be painful. So please don't worry. And if it's been a long time and you're going to see the dentist and you're thinking, oh gosh, I've got to walk through that door, please hold your head up high, because that's the first step of making your way through making a change for yourself. Nobody is there to judge you. Everyone is there to help you.
Thanks, that's really reassuring. And we probably have time for one more question, and that is there a simple way to whiten your teeth?
So that depends on where the stains are. So if the stains are outside the teeth, so that could be dietary, coffee, tea, spicy foods. The simplest way to do that is to firstly go see your dentist or hygienist. They can give you a good scale and polish and get rid of the stubborn stains. And then if you use an electric toothbrush regularly, that should keep them at bay. But if the staining is from within the teeth, so it could be either tetracycline staining, which is an antibiotic that some people might have taken over a long period of time. It could be smoking, so smoking infiltrates all the way inside the teeth and just stains them really, really badly. Or it could be just age, because the teeth get thicker as we get older, so the light shines through in a different way. So there are all these different kind of reasons why they might be internal staining. And for that, the only realistic way of whitening your teeth is to actually have teeth whitening done. And that's something, again, it's painless. I mean, some people get a little bit of sensitivity the morning after, but it's completely non-invasive. The dentist doesn't have to pick up the drill for anything. It's the easiest way to whiten your teeth, and the dentist can guide you through that.
Brilliant. Great. Well, thank you so much. Is it okay if we have you for a little bit longer in case there's questions at the end? Because I think we'll move on to the part 2 of the talk.
Sure. Thank you.
Thank you.
Lungs are the organs which determine the very essence of our lives, prana. Keeping our lungs healthy is a spiritual discipline. As we know, COVID-19 mainly affects our lungs and can also cause lasting harm to our lungs. Now, more than ever, we need to take care of our lungs. Fortunately, over 80% of affected people escape only with mild symptoms. In a small proportion of people, COVID infection can start off as a simple cough and progress to severe breathing difficulties as the lungs start to fill with fluids and develop clots. We are privileged to have Mr. Anbu Jayakumaran with us today to discuss how we can protect our lungs with various exercises. Mr. Anbu Jayakumaran qualified as a physiotherapist in 1998. He completed his master's in 2002 and has been working for 15 years in the NHS. He has great passion for respiratory care and currently works as oxygen specialist physiotherapist. Brother Anbu has been an ardent devotee of Shirdi Sai Baba since 2006 and consciously tries to follow Baba's teachings and sees Swami in all beings. Anbu's favorite quote of Baba is, "Do not entertain the sense of doership in doing good or bad deeds. Be entirely without pride and without ego in all things, and your spiritual progress will be rapid." Sairam. Now over to Brother Anbu.
Sairam, everyone. Good evening. I'm Anbu and Jayakumaran. I'm a respiratory physiotherapist. And this evening, I'm going to share some breathing exercises for people with chronic respiratory conditions. I'm going to begin my presentation with our beloved Bhagwan Sri Sai Baba's quote. All service should be regarded as an offering to the God, and every opportunity to serve should be welcomed as a gift from God. When service is done in this spirit, it will lead to self-realization. Just to give a snapshot of what the respiratory physio does in community or primary care is, we do the breathing test and assess people for oxygen requirement, either by blood gas analysis and by exercise testing. And we run the pulmonary rehab exercise and education program for people with chronic respiratory condition, optimize their medication, prevent people with chronic respiratory condition from getting admitted into hospital, and if they do, support them to get out of the hospital as soon as possible. And at the moment, we are assisting people with COVID requiring oxygen on discharge and supporting them to come off their oxygen at home. So that's what it's keeping busy as at the moment. Just to get the impact or severity of the respiratory conditions, there's about respiratory conditions account for about 700,000 hospital admissions every year and cost about 11 billion to the UK economy, and about every 10,000 people diagnosed as to have a lung disease every week, and approximately 1 in 5 people has ever developed COPD, asthma, or other chronic respiratory conditions, and half of them are on medication. And unfortunately, lung disease is the third biggest killer in this country. And most importantly, all the above, the chronic respiratory conditions, all of them are not curable, they are treatable. So it is very important to see how we could manage the conditions effectively. So hence I've come up with this presentation. So when we say the respiratory conditions, the most common ones that we encounter are the COPD, asthma, bronchiectasis, ILD, and breathing pattern disorder. COPD, which is nothing but a chronic obstructive pulmonary disease, which is a narrowing of their breathing tubes and damage to the air sacs of the alveoli. And the asthma, which is the narrowing of the breathing tubes due to bronchospasm. And this is reversible, whereas our narrowing of the breathing tubes in COPD is irreversible. Bronchiectasis, here there is a structural damage to the wall of the breathing tubes, as you could see here in this picture, and it presents with classical symptom of excessive mucus production. And our idiopathic pulmonary fibrosis, where there is the soft tissues between the air sacs become fibrosed, and that leads to the restrictive lung disease. And it's a cluster of lung conditions due to rheumatoid, sarcoid, and there's different types in idiopathic pulmonary fibrosis. So whatever the lung condition may be, the respiratory symptoms appear. The respiratory symptoms are common, which are shortness of breath, cough, and wheeze. And those are the symptoms that we are going to see today due to the time constraint. And as I mentioned, cough, I just want to highlight the red flag. Like if somebody is coughing up blood, fresh blood, then that is something serious that needs urgent medical attention and assessment. So the breathlessness, breathlessness management that we're going to discuss now applies only to people with chronic respiratory conditions. So for managing the breathlessness, I'd like to introduce the acronym 3Ps for people with chronic respiratory condition, which is pacing, positions of ease, pursed-lip breathing. The pacing is stopping before you have to. So by pacing, one can keep their symptoms under control and they don't let the symptoms take over them. So this is the important strategy that is often missed because people have been used to, lead a very busy, active life, and they like to get things done in one shot. They just want to do, if they get on hoovering, they just want to get it done all in one go, and things like that. But they forget they have got a new chronic lung condition that is going to affect their ability to do that. They must pace. Okay, so pacing is the key thing, and it works, amazingly well. So please pace yourself if you have chronic respiratory condition and if you suffer from breathlessness. The next P stands for positions of ease. There are certain positions that help people with lung condition to feel less breathless. Such as forward lean position, like is leaning on the table or leaning forward with the elbows on the knees, or leaning on forwards on a high windowsill or a kitchen worktop. All these positions can help people with chronic respiratory condition to feel less breathless. If you wonder how does that help, yes, it helps by several reasons. The most important would be when we lean forward, what happens is we all have got the main muscle for breathing, the diaphragm. So when we lean forward, that stretches it. So when any muscle is stretched, it works effectively. So when the diaphragm is stretched, it works effectively, and it makes and it helps the people with chronic respiratory condition to feel less breathless. Also, when we lean forward, what we also do is, I'm sorry, I'm trying to show you. When we lean forward, what we do is we stabilize our shoulder girdle. So we prevent the neck muscle and the shoulder girdle muscle of being used when we are breathless. When we are breathless, what we tend to do is we tend to do rapid, shallow breathing. And in that glucose, what you do is you use the accessory muscles around here, the neck and in your shoulder girdle. So when we use these muscles for breathing, those muscles are not meant for breathing, so they fatigue easily. Okay, number one. And when we use those extra muscles, that's going to make you feel more breathless, because that's going to need more energy. That's going to make you feel more breathless. So this forward lean position, so stretches your diaphragm and makes your diaphragm more effective, and then it prevents or blocks the accessory muscles from coming into play. So that's why this forward lean position is very, very important. I've got a couple of pictures in the next slide, which you could have a quick look. So remember the pacing and positions of ease. And the next P stands for pursed lip breathing or breathing control. So we've discussed that people with breathlessness, when they encounter breathlessness, the normal response would be to breathe rapidly, thinking that if we breathe quickly, we could get more air in and that might help. But actually, that would worsen the situation. It is easy for people without lung condition to say, so slow down your breathing, control your breathing. But how to do that? That's a very simple, easy technique. That's this breathing control. What is it? Is like just prolonging the exhalation. That means breathing out longer than you breathe in. This, to begin with, you can begin with like, if you're going to breathe in for 2 seconds, try to breathe out for 4 seconds. So twice as long as you would breathe in, and then gradually build it up. So it's important also to note what is the reason behind this. So for people with COPD, they have difficulty in the breathlessness is mainly from not being able to exhale the used gas. So there is air trapping, the hyperventilated lungs where they say. So the air trapping, there's used gas in the inside the lungs. So they can't take more fresh air. So but instead of getting out, they think the breathlessness is from getting in, difficulty to get air in. They try to do this rapid lab-mode breathing. So what it is, it's actually making the symptom worse. So instead, if they focus on breathing out, so in through the nose and then breathe out through the mouth, the pursed lips, for as long as they can do it comfortably. Okay, you can breathe out through the nose as well. That's absolutely fine. But people with COPD often, if their COPD is so severe, they may have got a floppy airways, very floppy. So when they do exhale completely, it can collapse their airways. So they just do, instinctively, and they keep some air in the buccal cavity to splint open their airways. So if your COPD is not severe, or if you don't have COPD, you can do this breathing control by breathing in and out through the nose, but for as long as they can. And so this breathing control, we could adapt it in using another tool called breathing rectangle. So this breathing control can be done along with the breathing rectangle. That means following the edges of your television or in a picture frame or a wall art, anything that is in rectangle shape. So the key thing is they need to follow the smaller side for breathing in, the longer side for breathing out. So I'm just going to practice once now. So what you do is when you do this, it works by 2 principles. It takes the mind off the breathlessness, and it avoids the individual getting anxious and panic, because that's going to affect the breathlessness as well. It's another vicious cycle. So if you're breathless, that makes anxious, and when you're anxious, that makes you breathless, make you breathe more shallow breathing, that makes you more breathless. So it's another vicious cycle. So it takes your mind off the breathlessness, and physiologically, what it helps is to exhale, empty your lungs. It helps to remove, exhale the used gas inside your lungs, and it's a wonderful tool. It gives instant relief. So please try if you suffer from breathlessness from chronic respiratory condition. And another interesting tool is called what we call a fan therapy. Just holding small handheld fan about 15 centimeters away from your cheek, and that helps to reduce the breathlessness. It is believed that it stimulates some superficial sensory nerves in your face, and that has some effect on your respiratory center. And last but not least, the weight management. Even without people without respiratory condition, if they carry some excess load, it's going to make them feel breathless. So it is very important to focus and stay in a healthy weight range. And if you are over, please access support and do some physical exercises, or watch the diet and try to stay in the healthy weight. That would definitely help you with your breathlessness. And these are the positions that we discussed, like sitting in forward lean position and sitting. And here there's one at the table and elbows on knees. and again leaning on the chair. These are brilliant postures. And when you tell them the benefits to people with chronic respiratory condition, they say, "Oh, I do this anyway." So their body tells them to do it by anyway. So it's very important to make note of that. And this is the breathing rectangle that we discussed. So follow the edges on the smaller side for breathing in and the longer side for breathing out. And the next symptom that we're going to focus this evening is cough. From the management perspective, I've broadly categorized cough into two, dry and productive. Dry is where you don't have any mucus or secretion in your chest, but it just irritating, dry, tickly cough. So the more you cough, the more you're gonna feel the urge to cough. So the best way to deal with this cough is to stop coughing. So we've got a simple exercise to do that. So which we will see the next slide. And if your cough is productive, that means if you have secretions in your chest, if you're coughing up phlegm, then you need to do different type of exercise called airway clearance exercise to clear the phlegm and keep your airways nice and clear. So the cough suppression exercises. So when you have the urge to cough, okay, hold your breath and count for 5. 1. And then sip some water and then swallow while tucking your chin downwards. This helps. Okay, so please try this cough suppression exercise if you have dry, tickly, irritating cough. And if you have mucus in your chest, then you will find this exercise, active cycle of breathing techniques, very useful. Okay, so we all do have mucus, and that's cleared by we all have got a hair-like structure called cilia within our airways that beats constantly about 60 times every second and constantly moves the aids in the secretion clearance. People with chronic respiratory conditions, this mucociliary clearance can get impaired, or the airways may secrete more mucus, as if in bronchiectasis, for example, or their mucus can become viscous, very sticky, where this normal mucociliary clearing mechanism can become a bit difficult. So this exercise is helpful if you have difficulty clearing the chest secretion. And this exercise is called active cycle of breathing technique. It's a very simple, easy exercise. You can do it any time, any position. You don't need any device. All that you need is time and patience to do that. Only thing I would suggest is don't do this exercise immediately before or after food. If you do it after food, you would feel sick, and before food, you may not enjoy it. So just leave it 45 minutes. If you have, other than that, you can do it anytime, any position, anywhere. So the exercise is there's two different types of exercise. One is the deep breathing, another is huffing. These are the two important components. The two are really intense. So you're going to mix it with the normal breathing exercise, normal breathing in between. So you start here with 3 normal breaths and then do 4 deep breaths. So what this deep breath does is that when you do deep breath, deeper than normal breath, the excess air get behind the mucus through collateral connections, and you do that 4 times, and then you move on to 3 normal breath and then 2 huffs. So what is this huffing? Huffing is nothing but a forced expiratory technique. You just take full breath in and then and you do once more. So full breath in. So you breathe a little bit forcefully with your open throat, and that exerts a squeezing effect on your breathing tube, and that pushes the phlegm. And you do this about 5 to 10 cycles, and by then, your mucus should get to the, larger airways, a windpipe, and you should be able to clear it with a cough. Okay. And other things to help with the mucociliary clearance is try to increase your fluid intake, because if you don't drink enough fluid, then that's going to make your mucus even more stickier, and that's going to affect it clearance even more difficult. And try to keep up with your physical activity little and often. So how does the physical activity help with the mucociliary clearance? When you do any physical activity, what happens is you increase the rate and depth of respiration. So that means more air moves in and out of the lungs. That helps to clear your secretions. And when these two are not sufficient, then we could help you with, give you some devices called oscillatory positive pressure, expiratory pressure devices, what we call OPEP, oscillatory positive expiratory pressure devices like a cappella, flutter, and that could help to clear the secretions. And if your mucus is particularly sticky, like people often say gluey, wallpaper like stuffy, wallpaper gluey like sticky, then you could ask your doctor to prescribe mucolytics or mucolytics like corbocysteine, where you take 2 capsules 3 times a day. That would help to loosen your mucus. And when you do this exercise, it'll be easier to clear it out. So 5 to 10 cycle, 3 to 4 times a day. And if you are on any inhalers, it's very important that you do this exercise before taking the inhaler, because that's going to help to help your inhaled medication to get in deeper and stay in longer in your lungs. And it's if you're having recurrent issues or constant issue, you do at minimum twice a day, once in the morning, as soon as you get up, once at night before you go to bed. So that's the exercise to clear the chest. So we have seen how to manage your dry cough and how to manage the breathing exercise to help the wet productive cough. The next important bit is breathing retraining. So what happens is like we all breathe through the nose, but some of us might breathe through the mouth, through they might have just started doing, when they may have a blocked nose or have some respiratory infection or some childhood illness, but that have become their normal breathing pattern. So nose is for breathing, mouth is for eating, drinking, talking. Okay, so it's very, very important we breathe through the nose. Some benefits, I'm sure we all know that it helps to moisturize your airways and regulates the temperature of the air that you breathe in and filters the traps and bugs. And also, very importantly, not many of us may know, it stimulates the nitric oxide production. Nitric oxide is a chemical that our nasal sinuses produce, when the air flows in through it. So nose breathing helps in nitric oxide production. So nitric oxide helps in as a vasodilator, and it has some antiviral, antibacterial properties, and it also helps in increasing the oxygen uptake as well. So it is very, very important that we breathe through the nose. So the nose breathing, with nose breathing, we produce about 50 to 200 parts per billion nitric oxide. But when we do some specific breathing exercises like the humming, like as if how we do the, how we chant Om, like, okay. Om. And then you need to breathe in through the nose, shouldn't breathe in through the mouth. So when you finish that, if you breathe in through the nose, that gets into your body, that helps, and that has this wonderful benefit. So nose breathing. And the next one is the diaphragmatic breathing. So it's very important breathing to understand how we breathe normally. So we breathe through the main muscle for breathing, the diaphragm, that's the tummy. So if the normal breathing pattern, there shouldn't be any movement in your upper chest, or if at all, if there's any 80-20 ratio is okay. That means up to 20% of your breathing could be from the upper chest, and the rest of the 80 is from your lower chest or the tummy. So when you breathe, needs to be light, slow, and deep. So I'm going to do that once. You all can place your hand, one hand on your chest, one on your lateral chest, and then you can feel what happens when you breathe in and out, like light, slow, deep. When you breathe in, when we breathe in properly, the diaphragm, when we use the diaphragm, then the tummy should come out when you breathe in and should go in when we breathe out. So diaphragmatic breathing, nose breathing, this would help to control your breathing and practice the Om chant. That helps with the nitric oxide production, and we may get those benefits. And if you have issues with wheeze that responds to the inhaled medications, bronchodilators, or so just check your inhaler technique and use spacer for the, if you have the pressured metered-dose inhalers like the common Ventolin, and if you use any of the dry powder devices, make sure it's quite deep, it's quick and deep, and remember to hold your breath for 5 to 10 seconds after inhaling the medication if you're not using the spacer, and rinse your mouth after taking any of those long acting inhalers that has inhaled the corticosteroids. And try not to use your reliever inhaler often, not more than 6 times a day. And thankfully, British Lung Foundation has come up with a virtual package of pulmonary rehab, which is the exercise and education program for people with chronic respiratory condition. Those who are, need these can access these from following this link. And they are there to answer your any queries with regards to lung condition, and their contact number is this, and they are open from Monday to Friday 9 to 5. And so let's remember, let's avoid any irritants to our airways, smoking, not in any form, not even in passive, and please make sure there's no mold or condensation in our property, and please get the flu jab annually, and pneumonia jab if you have COPD, bronchiectasis, or IPF, which is usually once in a lifetime, and if you need more, your doctors would let you know, otherwise it's once in a lifetime. And another important thing to note is there is strong evidence now. Singing helps in lung functions and lung capacity. So when we sing, what happens is when we sing the long phrases, what we do is you prolong the expiration. And what we were discussing, the issue with the common respiratory, the obstructive respiratory condition is issues with exhalation, that you don't empty your lungs properly. So when you sing, you do that automatically, and your breath hold time also increases. So it is very, very good. And I would suggest let's just continue the bhajans that we do for Swami. That's going to help our lungs as well. And also let's continue the chants, chanting Om as often as you can. So remember to chant Om, and then when you do the humming, just feel the hum, and then when you finish the humming, please breathe in through the nose, but not through the mouth, for you to get the benefit out of it. Right? And on that note, thanks for listening. Hopefully this is you find this helpful. I would like to finish my session with Swami's quote: "Love all, serve all, help ever, hurt never." Om Sai Ram. Thank you.
Thank you so much to Brother Anbu. There are some fantastic practical tips there that I'm sure that we can all use. And even myself as a healthcare professional, I've learned so much from that presentation. So thank you. A couple of questions come through. Somebody's asked if they can use these exercises during COVID, or if they've had COVID.
Yes, definitely. With the post-COVID, the common symptoms are breathlessness, and that varies. Some people have few weeks, others have longer for 6 months and 9 months. So we have got a new service, long COVID recovery service. So the residual symptom is often the breathlessness and the dry cough. They may have productive cough during acute when it is acute or the first few weeks. After that, they have residual symptoms of breathlessness and the dry cough, for which definitely they should try and practice the breathlessness management of pacing, positions of ease, and nose breathing. Just they don't have to do the pursed breathing, but just the nose breathing in through the nose, but try to breathe out longer through the nose. And positions of ease and pacing, that's for breathlessness. And to try the cough suppression exercises, just to hold the breath for 5 seconds and then blow as if blowing the candle. They sip some water and then just swallow while they tuck their chin down towards the chest. So these works, and that's what the NHS Your COVID Recovery website advises to do these exercises. So it is perfectly safe and advisable to do those exercises.
Great, thank you. And I suppose on that note, is it advisable to buy a pulse oximeter?
Yeah, because of the COVID, it has the risk of silent hypoxia, where the saturation can drop down quite low when without patient having experiencing the symptoms of any severe breathlessness. So if they are vulnerable adult, I would definitely suggest and advise, and especially if they have any pre-existing chronic respiratory condition, definitely yes. And if you are tested positive, if you just want to keep an eye how you are doing, then that's absolutely fine.
Great. Anecdotally, I had a patient the other day who he gave a pulse oximeter to, and remember, it has 2 measurements. So it has the, the oxygen and the heart rate. And they read it upside down, and they ended up calling out an ambulance. So just be warned that there's 2 measurements there. Make sure you're looking at the oxygen.
Oxygen, yeah, the one with the percentage mark, not with the HR or PR mark. And if they put their pulse oximeter, it's very important. They need to make sure they don't have any nail varnish. If they do have, then that would affect the readings. And when they put their pulse oximeter, it's good to have, at the chest level, and leave it for at least for a minute. And they will have the signals go up and down. That needs to steady. If a reading comes up, that needs to stay for at least 5 seconds to be accounted as a reading. It just flickers for a moment for 88. Oh, it's gone down to 88, 60. No, but the next moment it comes up. That's not the actual reading. So you need to the reading, if it stays at least minimum for 5 seconds, then you can take it as a reading.
Great, thank you. Someone mentioned, is huffing the same as coughing?
Yeah, the difference between huffing and coughing is like, coughing is like rapid expulsion of air out of the lungs with their throat closed. The glot is the valve that closes the lungs and the valve between the lungs and the mouth. So when when the air rushes out of the lungs, if it is closed, when you close the throat, and that's coughing. Whereas huffing, you do that with your throat open. So that's not much strenuous. So that is mainly used a part of an airway clearance technique. So you don't strain your lungs and yourself with repeated coughing, and you end up with sore, chest and muscles. So it's better you do the huffing, move the phlegm up, and then cough when it is ready to be expectorated.
Okay. Shobnanti is asking if there's any advice on how to get rid of a postnasal drip.
Postnasal drip, yes, it's a again a chronic issue. If they know what triggers it, and just avoiding getting exposed to the allergen. If it is, that's a bit difficult to exactly identify. And so antihistamines, or the GPs can prescribe nasal drops like Avamace and Nasonex. They are very good now. They have got, it's just the nasal corticosteroids, but now they have got antihistamines as well. So that works. And from non-pharmacological side, doing regular steam inhalation and saline nasal rinse, just dousing the saline through one nostril and then coming, that helps. And again, nose breathing and regular, breathing exercises. Postnasal drip, actually, more than what is actually difficult and challenging in postnasal drip is it often presented as a chest problem, so it gets diverted, referred to the secondary care for the chest physician, and they get all the tests and everything done, and could be just the postnasal drip, that giving them symptoms of cough and mucus production. So if you know it is just pure postnasal drip, this should help.
Great.
They say just accepting it is, they produce, their nasal sinuses produce more mucus. Yeah.
Fine, perfect. I think that's a brilliant place to close, actually, because it's just reminded me that the next webinar will be Tuesday the 2nd of March, but by an ENT consultant. So yeah, there may be some more little tips there for you, but that was really helpful. And thank you all so much to all of our speakers. I don't think there were any further questions for our dentists either, but please do, you can always email in if there are any concerns or questions, and we could pose it back to our speakers. So thank you all so much for your time. I hope that was really helpful, and Sairam.